This is Dr. Scanterbury. I'm trying to get a good position to go on live here. I'm trying to do this from home, and I wanted to say thank you all for joining. This is Dr. Velma Scanterbury, and I am coming to you with Dialysis Patient Citizens Educational Center. This is our Ask the Doctor program. Thank you for joining us. Thank you, Steve and Yolanda and Jamal. I appreciate you being here. If you have any questions, go ahead and post your questions in the chat. I am Dr. Velma Scanterbury. I'm the medical consultant for Dialysis Patient Citizens Educational Center. And so today we want to talk about anything you want to talk about. First, I'd like to get the ball rolling with talking to all those who are listed for kidney transplant. Those of you who are in dialysis thinking about kidney transplantation, and those who are on the list. And so we want to talk about how to find a donor, how to find a living donor. And for many of you who are listed, I hope you are encouraging your family and friends to sign your organ donor card. We've had a few patients come through our transplant center, and they have, we talked about thinking about living donation as well as deceased donors, and they weren't even interested in organ donation. And I found that very disappointing, because if you are on the list for a transplant, your family should be on board with organ donation. And that is very important, because you are looking to others to donate to you so you can live a healthy life. And so it becomes important for those of you who are supporting your loved one to also know that this is a gift of life. This is a gift of life that you can help others. And I also want to talk about the fact that as someone on the list, or someone in need of an organ transplant, that you can use your story as your platform to advocate others to be organ donors and even to be a living donor. Oftentimes, many people are not aware of the fact of what we call direct donation. So I have a son who is a daughter who is on the transplant list. And none of my family members are unable to donate because we have the same disease process. Then you know that I can use that platform to advocate for others and to be organ donors. And someone at my job may then have an idea that, perhaps I can be a living donor, or talk to my family about organ donation. And lo and behold, one of my families passed on. And I remember, my friend has a relative who needs a transplant. And now that person is going to say, I want one of my loved one's organs to go directly to Mr. Jones' son because he or she needs a kidney. And so we can talk about about directed donation, in that person is saying, I want to give one of these kidneys of my loved one to someone I know on the list. And so when you share your story with others, other people become more motivated in case they have a loved one who passed on, to be able to help that person receive an organ donor kidney or liver, whatever it may be. So it's important to share your story with others, because you're not only sharing your story, but you're also educating others about the process. You educate others about the need for organ donation, the need to think about living donation, the fact that there are people out there who have a disease and a problem that you as an individual may be able to help. So there's a question about a patient was told he was ineligible for transplant because of calcium. And, one of the things that happens when you have abnormalities in your calcium phosphorus metabolism is that you can have too much buildup of calcium in your arteries, in all the fine vessels of your body. And so it's important to control your calcium and phosphorus metabolism, because when that's out of whack, it leads to worsening of what we call plaque disease. or arteriosclerosis. Arteriosclerosis is hardening of your arteries. And so many times I've taken a patient to transplant only to find that their blood vessels are so hard from calcium buildup that I'm unable to make that connection. And in order for me to make the vessel connections, the vein and the artery in particular, I have to connect that artery to a blood vessel, which means I have to make an opening into it. And if that blood vessel is very, very hard because of calcium buildup, I'm not able to do that. Sometimes you're able to chisel through and make an opening, but it be so thick that it then causes cracks to occur in different areas of the blood vessel, which can then lead to clotting of that blood vessel. It can lead to clotting if some of those small pieces of calcium go up into the kidney. We'll see kidneys not work because of that. So most of the time, it's not just that area of where you want to connect the kidney, but the fact that the plumbing or the pipe that's bringing the blood to that kidney may not be adequate enough because the calcium buildup has made the lumen of the blood vessels so much smaller. So that will lead to poor flow to the blood to that kidney, which may mean that kidney may not be successful in being able to work appropriately the way that you want it to work for that person. So I hope that helps. And it's usually one of the things we worry about is if you have that much calcium deposition in that area of your vessel, which is high up in your pelvis, we worry about the fact that they may, as that blood vessel goes down into your leg, you also have decreased blood flow because of calcium buildup in the blood vessels to your leg, which will put you at risk for clotting of that leg if we interfere with the blood flow going down to that leg, and the potential loss of limb, as a result of trying to put that kidney in. So it's not just that one buildup of calcium. Oftentimes we do a CT scan to see if one side is better than the other and that there's less buildup on the left side compared to the right side, in the hope that I'll be able to use a different site. But you also have to remember that in order to place the kidney in, we have to clamp that blood vessel both above and below to prevent the flow of blood in order to make that connection to place the new kidney. Now, if that blood vessel is crunchy and hard, there's no way we're going to do that without injuring the blood vessel, because we're going to clamp down to prevent the flow, and that will cause damage not just to the area where we're trying to implant the kidney, but also above and below when we're trying to block off the blood flow from below. And so you end up with an injured blood vessel, and like I said, loss of blood to your leg, which may be not repairable. So it's a lot of things happen there. I hope I hope that gives you an explanation of why it's important to be really conscious of your diet when you're on dialysis. Pay attention to your phosphorus levels. Make sure you keep your phosphorus under control. And I know that it's tough oftentimes to take those phosphorus binding tablets, but we know that one of the things that as you come to transplant, if you are non-compliant and your phosphorus levels out of whack, that's often a signal that you're going to have a lot of issues with deposition in your blood vessels. So it's mostly not necessarily the level of calcium as it is where the calcium is accumulated in your body. Some people even get what's called calciphylaxis, where there's deposition into the soft tissues, giving you ulcerations and giving you hard areas that become a medical issue. So thank you for that question, and appreciate and hope that whoever is listening for the answer, that I've done an appropriate job in explaining that. So thank you so much. So we want to talk a little bit more about advocating for living donation. We want to be able to talk about having someone, if you as a person on dialysis is not comfortable approaching family members, approaching friends about what it means to be a about considering living donor, think about having an advocate, someone who can speak on your behalf, and someone who can use the information that is put out there of various transplant sites and kidney sites to how to advocate for your loved one, how to go about getting them, getting your information about them to other people. For instance, use your church platform, use your community center. Not only is that an avenue to talk about kidney disease and even your journey to dialysis, or your journey to end-stage kidney disease if you're not in dialysis, but it allows others to learn about kidney disease. It allows others to realize that the two leading causes are diabetes and high blood pressure. And that both of these diseases being asymptomatic, meaning that you can have a very far advanced disease and not understand the consequences that both high blood pressure and diabetes ruin your blood vessels, and especially your smaller blood vessels that lead to kidney disease. Not only does it lead to kidney disease, it leads to damage to the blood vessels in your eyes. So you end up with diabetic eye changes, and people end up with blindness. There are those who end up with a heart attack because the blood vessels to their heart, the smaller blood vessels, become damaged. And so you have oftentimes silent attacks. And so many patients in the workup for a kidney transplant, will undergo stress tests and will find that they've had a heart attack in the past, and they never realized that they did because as a diabetic, those things usually don't manifest with symptoms. And so it's important to know and get checked. So the question is does a person who donates a kidney get any special privileges if they need a kidney in the future? And yes, they do. So one of the things as living donors is that we want you to understand that we're not going to choose you as a living donor if there's any underlying predictable signs and symptoms that we can say you may be at risk for kidney disease down the line. So yes, there are people who may be have underlying high blood pressure, but because of their age, they're in their 50s or so, and they have no consequences of that high blood pressure, and they're donating to a relative, they can still be a living donor. And so anyone who in the past has donated a kidney, say 20 years ago, 25 years ago, as a young person, and now they come forth and they have kidney disease, they are able to get extra points to get transplanted above everybody else. And so as a living donor, you get special privilege to get on the deceased donor list. And oftentimes you supersede everybody else because of that gift of donation. You're below the children, but above everybody else, except for those who have high antibody levels. And so you do get an opportunity to get transplanted. And many of these past donors can often, if recognized early on, can get listed when the EGFR gets at 20% or less, and then they're able to get transplanted with very little to no time on dialysis. And that is such a great advantage. So I've only had one patient who had been a donor and had been on dialysis because her doctor was not aware that she had been a living donor, and the advantage that she received being a living donor to someone else. When she came forth to get evaluated for kidney transplant, we said, do you know you can get transplanted in the next few months based on your blood type? And I said, pack your bags. You may get called quite early. And she was like, I'm not quite ready yet. I'd give me some time to think about this. And lo and behold, she was transplanted within 4 months of getting on the list because she had that privilege. And so it's important to understand that for us in the transplant arena, one of the things as patients come to transplant is that we want to make sure that they're free of infection. There's a question there about sepsis. Explain it. Sepsis is when you have an infection that has gone from that confined area of your body, now that it's throughout your body. So you present with, you have, let's say something as simple as a bladder infection. And so you thought you had a bladder infection, and this is, say, a transplant patient, and but your bladder is your kidney transplant is so now very close to your bladder, so but you actually had a kidney infection. And so before you know it, you have fever and chills, which means that now the bacteria has moved from just your kidney to in your blood. And so sepsis is when we do it. You now have all these bad bacteria that was initially in your kidney has now seeped into your bloodstream. So when we do a blood test to send your blood to be analyzed, we find that there are bacteria already floating around your blood. There's bacteria in your urine, and now you have what's called sepsis, because now your body has been susceptible to this infection. It's gone beyond your kidneys, and now it's in your bloodstream. So when you have sepsis, it causes your body to release certain hormones. You get very ill. You have your blood pressure may go down, your fevers will go high, and your body slows down. Sepsis often will require intravenous antibiotics to try to overcome the bacteria that's there. Some patients may, depending on whether, develop other complications from the sepsis, which can often shut down their ability to breathe. Some people may need to be on a ventilator, depending on how overwhelming it gets, especially if you are immunocompromised and develop sepsis. And it requires not just treatment with one antibiotic, but it usually requires us to pull out the big guns to cover all areas of both aerobic and anaerobic types of bacteria. We check to see whether there's fungus infection, and if you are on immunotherapy, such as with your if you are on 3 drugs for your kidney transplant, we would often lower some of those to allow your body to help fight that infection. So sepsis is very virulent, and it can get out of hand. And so we tell patients, if you think you have an infection, make sure you check with your doctor early on and get your antibiotics started so that you can not let that infection go on to sepsis. Another, is there an age limit for transplantation the same in every state? No, the limit for transplantation varies from program to program. It may be even within the state and have different age limits. So if you look at we're here in Delaware, we have only one program. If you go to Pennsylvania, which is right across the border, they have many programs, say 8 or 10, and each program will have their own criteria for the age limit, depending on whether it's we're talking about kidneys. Most people may say 75. There are a few programs may go 78. There may be programs who may go to 80. More and more, you want to decide whether each program will evaluate patients. We may say a age limit of 75, but if you are already on the list and you hit 75, most programs will not take you off at 75. Will give you another year maybe to see where you're coming up, and if you're coming close to getting transplanted, or they may offer you some kidneys that others may turn down to see if you want to be able to get transplanted and come off the list. So it varies from program to program, even within the state. So some patients may get turned down for a deceased donor, whereas a living donor, that may be different. So you always want to check with that program and see what the age limit is. There are those who are requesting to be live. Let's see what. And are there any other questions? Thank you all for that question. I appreciate that. One of the things that we also were talking about is we have about 10 minutes left. Put your questions in the chat. We were talking about advocating for your family as donors. If you are a potential person, we want to if you're a potential donor, you want to know the risks and benefits of being a living donor. You want to talk to other donors. Some people are very apprehensive, but once you're able to speak to another living donor who can help alleviate your fears, can walk you through the process, can answer your questions that perhaps the transplant center itself may not be able to answer, and understand the recovery period. We wouldn't take anyone as a donor unless they're medically cleared, and we want donors to feel comfortable donating because they're giving of themselves. They're a healthy person. They're the ones who go into the operating room without any possible medical issues. They're there to be put to sleep, not for themselves, but for the benefit of others. And so it's upon us as doctors to make sure they're healthy and that they're going to do well. You don't want others to be you don't want a donor to succumb to anesthesia. So you want to do what you can beforehand to rule out a donor. This is why there's an age limit to living donors. Can someone be a 78-year-old and be a living donor? They have to be in tip-top shape because the other side of the coin is who are they donating to? Because a kidney at age 78 may be already, remember that kidney is already 78 years old. Not so much the person wants to donate, but the benefit of taking that kidney from someone who's older to give to someone, it may not be beneficial considering that kidney has 78 years on it. So it's not so much that they're healthy to go through the process, it's what's the outcome of that kidney to someone who may be younger than them. And secondly, what will become of that 78-year-old with one kidney? Let's say his eGFR was 85%. As we get older, our kidney functions decrease. And now you've taken away one kidney, and now he's left with 45% kidney function. You want to be able to make even less depending on what his initial function was. And now you want to make sure that that person isn't going to end up on dialysis as that one kidney deteriorates, and as making sure that he doesn't have high blood pressure and diabetes and other problems. So when we consider someone who's older as a living donor, it's not so much just their age, but also what is the function ability of the kidney at that age. I'm in my 60s and already my eGFR is about 70%. So it makes it okay. So if I give one of my kidneys away, what am I left with, and will I be okay in 10 years with that kidney, with half that kidney function, and will I be too old to get on the list for a kidney transplant if I develop kidney disease 10 years from now? So those things are important to consider when we look at people who want to be older, when we look at older donors who want to donate. So thank you all for being here. If you have any last questions, let me know. Thank you, Jamel. And those who are on the call, I don't know how to allow you to join. I tried clicking the button and giving you ability to be live, but it doesn't seem to be working. So I appreciate if you have a question, put it in the comment. I can answer it as much as possible. Again, join Dialysis Patient Citizens at dialysispatients.org. We have a Facebook Live that I'll be doing in 2 weeks at Dialysis Patient Citizens. We also have information online on our website so that you can gain more information about what it means to, how to improve your time on dialysis, how to have better outcomes, how to advocate for politically for those things that are in your state that is ongoing. There are lots of bills being passed. You want to be able to speak to your state representatives about things that can benefit dialysis patients. There's also lots of information on upcoming trips. I see someone posted that they're a dialysis patient advocate, and they're looking forward to the trip to DC in October. That is wonderful. Thank you for posting that information. And for those of you who are interested, please go to dialysispatientcitizens.org and get more information. Join our Facebook group, join our Instagram group. You can also sign up to receive the newsletter Jamal Felton says he's also an advocate and he'll be there as well. So awesome, awesome. This is wonderful news. And I want to tell you guys that this is a platform where you can ask questions. We will try to get your answers. If I can't answer them here, we'll try to do it either online, or we have a online platform where we can answer on the website. And as questions come through, I try to answer them as best as possible. So for all of you who are going to DC in October, congratulations. The more representatives we have, the better it will be, because then you can gain all that needed information to go back and really be helping those who are on dialysis in your region and be able to bring that information back. So I thank you all for signing up and being there as advocates. We need more advocates. So if there's many of you on the call who are not advocates and something you want to do for the patients in your area, feel free to, again, go to our website, dialysispatientcitizens.org, and get more information. Do what you can to educate others in your unit, educate others in your area, and begin to get patients to wellness. They had, in terms of making sure they're seeing their physicians, not just the nephrologist, making sure they have a primary doctor. That's very important. You want to make sure that you are being screened for other things that may be important to your health. Have you gotten your colonoscopy? Are you getting checked for any potential cancer risks? Is there a risk of breast cancer in your family that you need to know about? Is there a risk of thyroid cancer? Are you, if you're just hypertensive, are you getting your hemoglobin A1C checked to make sure you're not at risk for diabetes? And so are you getting your cardiovascular work being done? If you're on the list, transplant list, you get these done automatically, because most transplant centers want to see an echocardiogram and a stress test on an annual basis. But if you're not on a transplant list, you want to make sure, especially if you're diabetic, that you get your cardiovascular workup done. So I thank all the patient advocates who are on the call today, and I thank you for joining us. I thank you for being an advocate, and continue to do all the good work you're doing, and bring one other person along with you so that they can learn and experience the wonderful work that's out there to be done. God bless everyone. Have a wonderful day. Stay healthy, stay in the shade, use your sunblock, see your doctor, and we'll see you next time. Take care.